Here with Josh and Paul and two good friends I'll introduce in just a few minutes. First, let me give you a quick snapshot of where we are. I think that things are stabilizing, and so far it looks positive in this sense. A lot of testing, so it's a real number, 42,000 tests in the day. A 2.4% positivity, that's the lowest one day in some time, in a few weeks, but don't put too much on a one-day average. Hospitalizations +1. I like to see that stabilizing. Fatalities 5. Where were we a year ago? It's worth remembering that exactly a year ago, April 8th, in the second month of COVID back then, we probably had an infection rate north of 30%. It was tough to calibrate because we weren't doing nearly as much testing, 30%. Back then, we knew exactly. We had 1,400 COVID-related hospitalizations 1 year ago. And that went up to 2,000 over the course of the next two and a half weeks. We had 58 fatalities 1 year ago on that day. We had 5 yesterday. And that 58 went up to about 200 when it peaked. So I think when I see these numbers is hopefully things are stabilizing and we're making a difference thanks to the vaccinations. But we've got to be really careful. And different towns have different situations. I think you can see here the COVID hotspots. It's sort of the valley, those towns in yellow. Waterbury with 69 cases per 100,000. So what are we doing about that? We're bringing the vans to Waterbury. Remember back when Danbury was hit hard, we did extra testing. Now we're really bringing in the vaccination vans, making this an incredible priority right up and down through the valley to make sure people get vaccinated. Make sure that people are reminded how important it is that you wear the mask. I'm not quite sure why this is happening, but we are paying particularly close attention to it. And I also pay attention because, look around the rest of the country. We're stabilizing here in Connecticut. I think we're stabilizing in New York and New Jersey. I see the Midwest. I see Michigan. I see there's still some flare-ups. And when you look at a place like Michigan, you really focus on Detroit. That's where the flare-up is. An urban community where people are much less likely to get vaccinated. And we're not going to let that happen in Connecticut. We're going to make sure that everybody gets vaccinated, and we make it easy for you to get vaccinated, and then you got to make it easier on yourself and go get vaccinated. So that gives you an idea of what we're doing in Waterbury, where you see the hot spots here. Same thing happened in 1918. Things stabilized after the second wave. And then in 1919, 1920, had some flare-ups in those particular communities where people let their guard down, and let's not let that happen in Connecticut. Here's the vaccine update. 49% of all adults over the age of 16 have received their first dose. 49%. If just a dozen or so more of you had gotten vaccinated yesterday, I'd be able to say over 50%, but 49% is pretty good. Obviously, big majority of the folks over 45 have gotten vaccinated. That makes a difference. I would like to focus a bit on the younger demographic, 16 to 44. We're doing well there, 23%, up about 8% or so since last time. We'll talk about the younger demographic in just a minute because it's really important. Compared to where we were a year ago, today is sort of the polar opposite in this sense. A year ago, we were terrified of the seniors. They're the ones suffering the greatest risk. They're the ones, the nursing homes and beyond. That's where the fatalities were. And that's where we had to really maintain our social distancing and quarantine. Today, the vast majority of our seniors have been vaccinated. They're in a much safer position, and they are able to enjoy themselves with caution, wearing the mask a lot more than they were before. And you're able to say hi to your grandpa, provided you've been vaccinated. And they're the greatest, unlike a year ago, the greatest infection risk is in the age group 20 to 29. And that's a group I'm going to focus on. get vaccinated. We still have the vaccines, although we have been hit by Johnson & Johnson. I think you probably know they had a problem in one of their manufacturing facilities. We maintained our dosage of Moderna and Pfizer and J&J this week, which is great. Next week, you're going to have a lot fewer J&J vaccines. I think it's 6,000 going down to probably, I think it's 20,000 going down to 6,000 the week thereafter. So if you got a chance to get vaccinated, don't worry about the brand. Just get the option. So anyway, here are my two friends I wanted to introduce to you. One is our great friend, Senator Will Haskell, and Ed Ford. Ed's from Middletown. Two of those young, invincible 20-somethings. And I'm just wanted them to have a chance to say why they got vaccinated. They got vaccinated publicly. Pretty buff there, Will, looking good. And put that right up on their social media so we could remind their friends, and their friends could say why this was so important to do and what a difference it makes. Will Haskell, you're right there. Why don't you kick it off for us?
Sure. Well, Governor, thanks so much for having me on. Of course, thank you for your leadership throughout this pandemic. I'm here because exactly like you said, a lot of young people tend to feel invincible or immune to COVID-19. And we know that sometimes students procrastinate. I can be guilty of that. They might not feel an urgency in terms of getting their appointment. But we also know that this virus, it uses young bodies. Even if we don't get sick ourselves, COVID-19, it travels through us to reach our more vulnerable family members, our parents, our grandparents. It reaches the students and the teachers in our classroom who maybe can't get vaccinated due to an underlying condition. So I'm here to just say that to all the young people in this state, your decision as to whether or not you get vaccinated, and also when you get vaccinated, it impacts all of us in this community. It impacts all of us in this state. You can do your civic duty by visiting ct.gov/COVID vaccine. Make sure you've got a plan to get vaccinated when the clinics arrive on your college campus or in your school district. And please, please don't stop there. Doing your public duty, it requires going a little bit further. Text your friends, post on Instagram or TikTok if you're cooler than I am and know how to do that. Our generation desperately wants to return to normal life, but the only way that that can happen is if we all do our part. I got vaccinated alongside a handful of really inspiring young people at Stanford Hospital. It couldn't have been more efficient or easier, and I hope that everybody else decides to do the same, and I hope that they do so right away. Thanks, Governor.
Hey, Will, thank you. Really well said. Will mentioned college campuses. Over next couple of weeks, we're going to make a big effort. We're going to get our mobile vans out to the college campuses to make sure they are all able to get vaccinated. With that, let me introduce Ed Ford. Ed Ford from Middletown, councilman there. It's worth noting that Ed got COVID, and it hit pretty hard. So I don't think it was tough to convince him to get vaccinated. But I really, Ed, love to hear your story. And how do we convince all your friends to get vaccinated?
Certainly. Thank you, Governor, for having me on today. This COVID-19 pandemic has hit us all, and we see the facts. We see the data now. We know that young people, our demographic, we are very at risk to this virus. And so what we need to do is do our part and play our role, and we need to get vaccinated. I experienced COVID-19 myself firsthand. I had a fever of 103 degrees. I lost my taste and smell for 3 weeks. It was not fun. So it was definitely a point for me to go get vaccinated. I got my vaccine 2 days ago, and today I feel great. I feel better than ever. And I'm encouraging our generation who may be having some skepticism, who may, be looking at social media and find misinformation, whether it's on Twitter or Instagram. But I'm encouraging, as Senator Haskell said, for those of us who go and get our shots, for those of us who are experiencing the vaccine, to post and spread the word that the vaccine is good for us. The vaccine is helpful for us to get back to normalcy and a normal life here in Connecticut. Governor, you've been doing a great job leading the pandemic. And so encouraging our young people, I think, is the right way to go at this time. So thank you for focusing on the younger demographic today. Young people, go get your vaccines.
Hey, Ed, thank you. Really well said. I'm afraid Will and Ed have got to head off to other things. But you're right. We're trying to do everything we can to encourage young people. I appreciate you being here. I notice, in China, they hand out free ice cream cones to everybody that now gets vaccinated. They're having a hard time there. I noticed Krispy Kreme is now providing you a free donut if you get vaccinated. We'd like to get bars and nightclubs open. Maybe a few more young people get vaccinated. We'll feel a lot more confident heading that direction as well. So do what you can, because it makes an enormous difference. And finally, I'll end where we started. We're doing our best to get the vaccine to you and make it easier for folks to get vaccinated. These are one of our 35 vans. They're getting around now everywhere. I was out in Norwich. People lined up, just walk right up, get the vaccine. Really easy to do. There I was in North Hartford with Mayor Luke Broden. People just started seeing the van coming around. We gave some telephone calls. People lined up, and people are getting vaccinated. Our rates are getting lower. We're getting things under control. Hang tough a little bit longer. We're going to get there. With that, Paul and Josh are here. Any questions?
News 8. Unmute.
One of the things, Governor, that we're seeing, at least nationally, is a lot of the younger people, and you've talked about that, a lot of younger people now. So what is it, the mobile units? What is it, a combination of things now moving forward to try to get as many of the younger people vaccinated as possible?
Well, I think you heard from, Ed and Will. A lot of it is just a little bit of peer support. Go get vaccinated, get out there on social media, tell people you did it, tell them why you did it, talk about the experience, tell them to tell their friends. I'm probably a little old to be the role model there, but and if you love your parents and your grandparents, you want to be able to see them, you got to be able to see them safely, and you're still infectious. So I'd like to think that every day more and more of our young people will be getting vaccinated.
It seems like in a lot of different ways, you've been very creative in trying to entice and inform, and so on and so forth. Is there something along these lines, too, with a lot of these young people that maybe you can do, again, to try and entice them and get creative at it? Or do you feel that you've pretty much done what you can, and really it's up to them to take it seriously enough and get it done?
Hey, tell your TV audience, we're looking for ideas. The 1,000th young person that gets vaccinated will have a place in your TV show. I don't know. Let's figure out how we get people all the incentives we need to do it. We're going to have the vaccines. We've got the capacity. Now it's a question of you stepping up, getting vaccinated, and getting your friends vaccinated.
NBC Connecticut.
And good afternoon, Governor. Matt Austin with NBC Connecticut. I mean, when people do see the stats still, the daily case numbers, about 1,000 or so, is the state still doing a full contact tracing with all those cases to try to figure out, exactly where are those spots where we're still having, a lot of spread?
We are doing contact tracing. It's easier when you have, fewer infections. Josh, you want to speak to that?
No, that's right. We're still contact tracing every positive case. And making sure they and their contacts are taking the appropriate actions to quarantine and isolate as needed.
And I know you were talking about the potential kind of supply outstripping demand later this month, but I was on VAMS and it looks like there's already, dozens, if not hundreds of appointments for later this month. So potentially, have we already reached that point where there is more supply than demand?
Josh, what are you seeing? Same thing?
I think the key thing is what you just said, later this month. And that's what we had been expecting for a while now. And I think we're starting to see evidence of that. As providers have put more appointment slots online over the last several days, they're still getting grabbed up quickly in the coming weeks and days, maybe a little less quickly than they were a week ago. That's to be expected, right? We're vaccinating 40, 50,000 people a day right now. And so we're working our way through that backlog as we had hoped to. But certainly, if you've been holding out, if you've been waiting, you didn't want to wait online or hit refresh 1,000 times, this is a good time to get back into the system. You can call 211 and get an appointment on the phone right now. Or as you said, you can go on many of the provider sites or VAMs right now and get appointments locked in for the next week or two as there are opportunities available.
And finally, Governor, I know you were talking about the hospitalization rate right now is much lower, thankfully, than it was a year ago. But when people see that and say, oh, if people are getting COVID, they're not having the serious implications and complications that they did before, maybe they're going to let their guard down a little bit. How do you get people to continue to follow the guidance if maybe the most serious complications are not there?
Well, these are, young people, and these are young people who are the ones more likely to be going to the hospitals now. And you heard Ed say he was hit, and he was hit really hard. So nobody is immune, let me tell you. The only thing that makes you immune is when you get the vaccination. And so I think that message has got to be repeated over and over again. The only way to keep yourself safe, and you can get hit and hit hard as a young person, is to get vaccinated.
Okay, thank you.
Fox 61.
Hi, Governor. Zania Maldonado, Fox 61. Earlier this week, you talked about the main goal right now for the Connecticut population is 60%, to get 60% of our residents vaccinated. How are we with that? And will this Johnson & Johnson back up? I know you mentioned there might be a couple fewer appointments next week. Is that going to have any effect on that? Or are we still good to go with the 60% prediction?
I think we're still good to go. Look, the J&J is especially handy for the mobile vans where people are just doing walk-up because it's a one shot. And so we're going to have to be a little cleverer now with that because it's going to have a two-shot regimen with the Pfizer and Moderna. But I think overall our broad numbers are getting there. If the young people continue to get vaccinated, we'll get to that 60% pretty good. We're at 50% now.
And then also the COVID-19 hotspot map that you guys put up, very interesting. It does seem to be like a couple of clustered areas that are having higher population cases, but then there's also some outliers like Torrington, for example. Do we have any reasoning as to why these areas are seeing a little bit of an influx in cases?
Well, Josh pointed out that's, Union there in the northeast corner, and you say, hey, that's an outlier. What's going on? Let's say they have 6 infections and 800 people. So sometimes the numbers can be a little deceiving. I think what you see is there is sort of a regional impact here, as you see up and down the Naugatuck Valley from Waterbury down. And you see a bit of a regional effect in the United States in terms of the upper Midwest right now. It started out in Michigan, and you see a little bit going on in Europe, mainland Europe. So there are regional impacts to this.
News 12 Connecticut.
Hi, Governor. Just one question for you today. I'll go easy on you today. The state's two big business groups, NFIB and CBIA, both want you to commit to spending some of this American Rescue Plan money on replenishing the state's unemployment trust fund. The businesses are worried that if it's empty, the state still owes the federal government, that they're going to get hit with penalties. This is the wrong time to do that. What would you tell the businesses? I mean, would you be willing to commit some of that money to the trust fund?
Look, certainly think about it, John. I'm working with our delegation saying I think one of the great things the federal government could do that would be bipartisan support, I believe, is if you turned a lot of those loans to all 50 governments, state governments, into a grant. Because you've got 50 governments, all of whom had to borrow at the end of the day because the unemployment rate kicked up so badly 8 months ago. And that means all of us are going to have to raise the unemployment trust tax rate in order to pay off that surcharge. If they turned that into a grant, that would be incredibly beneficial for 50 states and be a tax cut for small businesses across the country. If I can't convince anybody of the importance and power of doing that, then you're right. Then we'll look at some of our other funding and see perhaps if we should put some of that into the trust fund just to mitigate the possibility that we'd have to raise those rates over time to make up for the shortfall.
Thanks, Governor.
Channel 3 Eyewitness News.
Yes, Governor, a quick question about the 35 mobile vans. Is there a public schedule out there? Because we're hearing from people in like Windham or Litchfield counties where pharmacies are limited who would like to take advantage of it.
Where is that schedule, Josh?
Yeah, it'll be published town by town with in conjunction with the local health departments as those schedules are finalized. So we've got our first group of the vans out in the field today, this week, and those are being well publicized. And as more vans come online, they'll be well publicized in the communities that they're going to as well. So if you're in one of those, and particularly in one of those higher SBI communities, and you haven't seen one of the mobile vans advertised yet, you will in the next week or two. And so hang in there or keep looking at some of the other options. As we mentioned just a moment ago, there are a lot of other options that are starting to free up appointments in the coming days.
And in terms of the rural areas, the vans will be going out there as well?
We're really looking to focus them, at least initially, on our higher SBI communities, and some of those are in some of the more rural areas. So there can be overlap there, certainly. And then as we get deeper into the late spring and summer, we're going to, again, as the governor mentioned before, we're going to be looking to get creative, sending them wherever people may be gathering, if it's a fair or an event, to try to, make it as easy as possible for everybody to get a vaccine if they hadn't yet gotten one.
Got it. And I had a real quick question about the plans for college campuses. Now that the Johnson & Johnson shipments have dramatically declined, is the plan going to change at all? Because UConn may be done with in-person classes in just a matter of days.
Keep going, Josh.
Yes, the plan will have to change. Our plan had been to give college students opportunity to receive Johnson & Johnson before they leave, knowing that we didn't really have enough time to get them a second dose of one of the mRNA vaccines, most likely before they head home for the summer. But what we're going to do is give them at least a first dose of an mRNA vaccine, the Moderna or the Pfizer vaccine. And the governor has been working with the White House and other governors to encourage them to do the same, with the logic being that by the time we get to mid to late May, there's going to be a lot of extra vaccine in all 50 states, and that we can take responsibility in our states for students who are coming home who had only gotten that first dose of 2. We'll have second dose opportunities available for those college students, later in May and June to make sure they can complete their course. So it'll be potentially a little staggered getting your first dose in one state or your second dose in another. But nonetheless, we want to continue to make that option available, even if we don't have J&J.
Got it. And this may be a little too specific, but do we have the percentage of UConn students who have at least received a first dose?
Do not have that.
Thank you, guys.
WTIC 1080 News.
Hi, Josh, do you have any more on the Johnson & Johnson situation? Is this just a one-week slowdown, or are we looking at the percentage drop over the next few weeks or months?
It's what we've been told is that it's a little bit indefinite right now. They need to get that manufacturing plant in Baltimore certified by the FDA, and they have not given us a timeline yet on when they expect to do that. So for the time being, we've been told to expect much lower quantities of Johnson & Johnson versus what had previously been indicated. But as we've discussed, we still have an awful lot of vaccine coming into the state. We had always anticipated the Johnson & Johnson deliveries to step down this week and beyond, but it's stepped down significantly more. But we still have a lot of vaccine, Moderna and Pfizer coming in. We'll be able to stay very busy and largely stay on track with our prior estimates.
Is it 20,000 this week and 6,000 next week? I just want to double check the numbers the governor mentioned.
So we had originally been told next week we would receive 20,000 first Johnson & Johnson doses on state allocation, and now we're told we'll only get 6.
And Governor,
and then the week after that, they've said it could go down to 2,000 until they get that Baltimore plant online.
Wow. Mr. Governor, anything on incoming Eversource CEO Joe Nolan? He says he's spoken to you quite a bit in the past.
He has. Look, I think it's a fresh start for Eversource. It's going to be a fresh start for how we regulate our utilities as well. Joe comes out of customer service. He knows how important it is to outreach to your customers, and I did stay in pretty close contact with him as we worked our way through ICES. So congratulations, Joe. I look forward to working with you.
The Associated Press.
Thanks, Max. Good afternoon, everyone. Governor, when the vaccination clinics are eventually held at high schools, will students need a parent or guardian to sign off on them getting a shot, or can teenagers just get one on their own?
Boy, that's a really good question.
Yeah, consent is required for 16 and 17-year-olds. So for high school students who are of that age, they will need a parent or guardian to consent for them, and different providers handle that in different ways. Oftentimes they do need to accompany them. But for 18-year-olds, no consent's required.
You just read my mind. Right now, like if there's a kid that's 16 that wants to get a vaccination, it depends on how they prove that their parent has signed off on it, or they can't just do it on their own?
Correct. And so each provider has, slightly different ways that they ensure that they're securing consent for any minors who are being vaccinated. So that'll be well communicated, at each of these clinics as they're rolled out.
And the vans that are down in the valley, do people still need to get an appointment, or are they walk-up?
So depending on the clinic, they're handled in different ways. So I just would encourage people to, go on your city's or your local health department's website. It'll be well advertised there on their social media. Many of them are now increasingly accepting walk-up appointments. I think that is going to be a trend that we're going to see accelerate in the coming weeks as more and more of these sites, not just the mobile units, but others will have walk-up availability. They'll probably, many of them, keep scheduling availability too. A lot of people want to have that certainty of booking that slot and making sure that appointment's ready for them when they get there. But we will see a lot more walk-up opportunities in the coming weeks.
So if you're in Waterbury and you see one of those vans and you haven't been vaccinated, feel free to walk up and see if you can get vaccinated.
Okay, great. And Governor, on a different topic regarding the migrant children, do you know how many Connecticut can expect to come to the state? How many more? And then do you know how many are currently in the shelters that are in Groton and Washington, Connecticut?
I don't know how many are in Groton and Washington. In fact, I didn't even know about that. That was unbeknownst to me. I can tell you that when it comes to our juvenile training facility, it's got capacity for, say, a few hundred kids, depending on how the feds would want to, arrange the cots and beds. So I think that's a good starting number. And it's going to be really based upon quality of care as well. We're going to be very strict about that and make sure that nobody cuts corners when it comes to these kids.
And theoretically, how long would they be here?
Theoretically, the feds have said a few months. I think theoretically is a good adverb because they have to place these kids all over the country. So it could take a little longer than that. Paul's going to be handling the negotiations with the federal government. Paul, anything to add?
Yeah, I think one thing to add is nothing has been finalized. We have not officially provided the federal government a facility within the state. As of right now, the governor has asked myself, Vanessa Durantes, our Commissioner of Department of Children's and Family, and Melissa McCall, our Secretary of OPM, to lead a process of due diligence as we go through this process based upon the request that was made to us and other states by the federal government. As the governor stated, one of the most important things is quality of care, wraparound services, as it deals with the undocumented and migrant children that was at our border. And while we have been provided a sense of the length of time that they've been asking for, similar to what they've stated at facilities which they've utilized convention centers in other states, we are preparing to identify a facility that can be able to be utilized for a time period that will go beyond what they asked for out of our own due diligence and preparation.
Okay, thanks a lot. I appreciate it.
Connecticut Public Media.
Good afternoon. I believe you might have mentioned this, so I'm sorry if I'm repeating this question, but with those vans, you had said they're only going to carry Johnson & Johnson. With the decline in the amount we're getting, will those vans still only be carrying Johnson & Johnson? Are they all the vaccines that were allocated, the Johnson & Johnson, only going to go to those vans for the next few weeks so that they can deliver that one-shot dose to the communities that need it most?
Josh?
Yeah, our current plan is to prioritize the vast majority of the Johnson & Johnson vaccine that we do receive to the mobile units, both the FEMA mobile unit, which is traveling the state, as well as the other mobile vans that Griffin Hospital is operating. There are some other small uses, but that's where the vast majority of the J&J is going to go.
Is there going to be enough to do what you've been doing, or just to supply all the vans, I should say, over the next 2 weeks with that reduced number?
We're working on the planning around that, and we are working on contingency plans in case we do need to supply some of those mobile units with either Pfizer or Moderna, how we would do that and how we would ensure we can have second dose appointments available for people who do receive vaccine through those mobile units.
And last question, I know you touched on why younger people might not be getting the vaccine, believing they're invincible or that, they won't get as severe infection, but have you heard why the rest of the population that is older than that 45 age group, the people that are hesitant to get it, their reasons of why they don't want to receive the vaccine?
I've been pretty impressed with the numbers, actually. I mean, well over 80% for 65 and above. Maybe remember from a few months ago, 50% are hesitant, I don't know. First round when we went through the nursing homes for the nurses was maybe 30%. So I'd like to think that hesitancy, every time you have a friend or a friend of a friend who's gotten vaccinated and say, I feel pretty good, I feel pretty liberated, I think you'll see those numbers continue to creep up, which is good.
The CT Examiner.
Good afternoon, Governor. This is Amelia from the CT Examiner. The Connecticut Retail Merchants Association expressed some concerns about a proposed state tax on digital advertising that would tax companies like Google and Facebook. Would you support this type of tax in Connecticut?
Hey, Amelia, that's an idea that's coming out of the legislature. And look, I think it deserves a look. I'll be blunt. I mean, the corporate income tax used to raise about 25% of our revenues here for the state of Connecticut. Now, very few companies pay it, and certainly not those big digital out-of-state companies that are here virtually, but not with a nexus or not with a physical location. So I'll take a look at what comes out of the legislature, but I think I understand where they're coming from.
Thank you.
The Day of New London. The Connecticut Mirror.
Thanks, Max. Governor, I'd like to go back just to make sure I get this straight to the Johnson & Johnson vaccines. Maybe I don't know if you want Josh to answer this, but tell me if I'm understanding this correctly. We were anticipating to get about 20,000 next week. Instead, we're going to be looking at about 6,000, and then the week after that, only about 2,000. I'm curious if we're going to still be able to stay at doing about 40 to 50,000 overall vaccinations, or is that not realistic at this point?
Go ahead.
No, well, so Keith, we'd always anticipated, there would be some step down headed into next week, as I mentioned. This week that we're in right now, we had anticipated to be kind of the high water mark in terms of total vaccine shipments into the state. So the decrease from what we had already expected to where we now appear headed is probably less severe than it otherwise would have been. But nonetheless, the total volumes coming into the state next week are declining. And so that, daily average, will come down to some degree, but it's still tens of thousands of people being vaccinated every day for, the foreseeable future.
Okay, thanks. Governor, could you tell me, did you have a time target when, you were hoping to see 60% of the population vaccinated by? Was there a particular time on the calendar when you were hoping we were going to hit that mark by?
I was hoping that within the next couple of weeks we would hit that number. We still have a really good chance to hit that number. We're at 50% right now, Keith, and I think what I'm thinking about is how it gets tougher and tougher once you hit that number to get those last people vaccinated, and how important it is that they get vaccinated. That's what our focus is now.
And then just lastly, Governor, I wanted to ask you about your teleconference meeting with the legislative leaders about the executive orders. My understanding is leaders from both sides of the aisle were kind of happy. I guess the administration whittled down, more than 300 different policies and directives to about 80. Do you think you're getting to a point where you can come to some agreement soon on which orders will be codified?
I hope so. Nora Dennehy, our new general counsel, said, I've broken down the executive orders. These are the ones that I think are important to continue post April 20th or May 20th. A lot of those are in and around vaccinations, since we're going to continue to have that as a real need. And we said, look, I don't need to make all the decisions. I'd love to sit down with, she'll sit down and say, these are the EOs that are really important to continue. These are the ones where we can have some discussions going forward. We'd love you to, be part of that process. That's what we talked about.
Thank you.
Hey, Keith, I might just say I like the article you wrote in the CT Mirror. We got a note on that. You focused on what we did in terms of, the Moody's rating, and this was, from the Volcker Commission, just sort of complimenting the state of Connecticut and our incredible group over at OPM, Office of Policy and Management, for the work they do in getting our numbers out, how they're pretty good, I take it, at forecasting and transparency, and while we still have some work to do on our pension obligations.
Well, whenever I can get a governor on the record saying that he liked one of my articles, that's a good thing.
Keep waiting.
Enough of that. CT News Junkie.
Thanks, Max. Governor, you mentioned earlier, or at least you alluded to, opening bars and nightclubs. Is there any threshold now that we're starting to get, younger folks vaccinated? Is there any percentage maybe that you'd look to before opening those businesses up?
Yeah, Hugh. Not yet. We got 23% of that age group has been vaccinated. Obviously, that's a demographic that's most likely to really enjoy the bars and nightclubs. So I'm going to be a little cautious. Hopefully, as more of them get vaccinated, we'll be more confident. And by the way, in the next couple of weeks, it'll be a lot easier to have that cool, frosty outside, which is so much safer.
So is it vaccination levels you'd be looking at when making that call, or other indicators like infection rates or hospitalizations or something like that?
I think all of the above.
Okay. All right. Thanks, everybody.
The Waterbury Republican American.
Thanks, Max. Governor or Josh, what is going on in the Naugatuck Valley? Why are we seeing such high rates there? And what, if anything, do state officials know about the leading causes of transmission? Is it households? Is it private gatherings? Is it religious services, restaurants?
I'll start. I think it's those informal gatherings. I think sometimes people are not as inclined to wear the masks as they should. We haven't done any analysis, Paul, in terms of where people are more likely to get vaccinated than other places, but I can tell you we're moving the mobile vans right into the valley, doing everything we can to make it easier for people to get vaccinated and make sure that we put out that small flare up there.
Yeah, and I'll also add, Josh and the team, we're working with local state officials, individuals like Senator Cabrera and others, to provide as much resources and services to support them. We've seen this trend over the past few weeks, identified it much earlier, and we'll be working very closely with those local officials so we can get these numbers down.
But shouldn't somebody be looking into why this is happening? Is the Department of Health doing any kind of analyses to determine what's going on there?
Josh?
Well, as I mentioned earlier, we do contact tracing on every case. And so given the high number of cases we have in the Valley, there has been a lot of additional follow-up and analysis there. It's often very hard to trace back to exactly where and when someone got COVID. But I think, as the governor said, the common themes that we've seen in other places where we've had upticks, not just in Connecticut, but around the Northeast, is people let their guard down too quickly. They get casual with mask wearing, particularly when they're indoors and when they can't keep adequate distance from people. So, we want to remind people to keep their guard up, keep the masks on a little bit longer, especially until you're fully vaccinated, and stay focused on those vaccination rates too. Make sure we're doing everything we can to get as many people vaccinated in those communities as quickly as possible.
And Josh, can you give us any update on how the state is doing in terms of reaching its goal, its SBI goal? I believe was it 31% of the 31% of the vaccine doses going to the 25 top SBI communities?
That's what the goal will, as eligibility is opened up to 16 and above, when we get the first full week of that eligibility class, that's what the target will go up to. I haven't seen this week's numbers yet, Paul, but we publish those every week as they come available. So they'll be out soon.
Okay. And Governor, has there been any discussion of the possibility of requiring a COVID-19 vaccine for students to attend school in the upcoming school year? I mean, I know you said a couple of weeks ago that was premature, and after the bill on religious exemptions got out of the Public Health Committee, members there supporters of the bill were stressing that this doesn't have anything, this is not a COVID-19 vaccine mandate.
Yeah, that's right. No mandates, but I will tell you that Rutgers and universities across the country have already noticed their students that to come back to campus in the fall, they want all those kids to have the COVID vaccine.
And any discussions regarding any kind of, for lack of a better term, vaccine passports? I mean, I don't think we've asked you about this in the last week or so.
Yeah, nothing has changed on that. I'm doing everything I can to, as you can tell, urge people to voluntarily get vaccinated. My hunch is, Paul, that you're going to see companies, be they restaurants or retail or maybe events, sports and the such, they may go their own way in terms of trying to keep people safe and asking them about their vaccinations, but no plans from the state government point of view.
Okay, thanks very much.
The Hartford Current.
Hey everybody, this is Emily Brindley from The Current. The first thing I wanted to talk about, Governor, you already mentioned this a bit, but I was hoping to ask this question from a slightly different angle. Sometime this month you're expecting that supply will meet the demand for the vaccines. So I was wondering if you could explain a bit about how at that point the tactics will change as far as outreach goes. Obviously you have the vans going, but is there anything else that you're going to be doing as supply reaches demand and you're looking at those more difficult to reach populations?
I think you're right, Emily. We're going to continue to get even more and more proactive. It's not simply a matter of people going to VAMS and going up to a drive-through clinic at Rensselaer Field. I think a lot of those people you're going to find by the end of next week or so have gotten their vaccine. That's why we're going to be driving the vans to those events where people are. We're going to be driving the vans to college campuses and get those kids vaccinated before they go. Go to those, congregate settings in urban areas, make the telephone calls, knock on the doors, get people there, walk up clinics, make it easier for you in any way we can. We're going to have to be very proactive.
Yeah, and I would just, in addition to that, I've had a couple other things that you'll likely see. Like, for example, this week, and we now have almost every pharmacy in the entire state providing vaccine, including in supermarkets where there's pharmacies. Right now, you need reservations for those, but very soon you'll be able to, just while you're out doing your grocery shopping, stop in and get a vaccination on the spot. We're also started this week to deploy vaccine to primary care physician practices, still larger ones that have kind of critical mass where you can go through volume at pace. But as we get deeper into May in particular, and we have excess supply, we'll be able to provide small quantities to these practices so that when you're in for your regular checkup or whatever it may be, you can get vaccinated on the spot there. So it's really, as the governor was alluding to, it's just about making it as easy and convenient for everybody where they are going already to be able to get vaccinated in their normal course of their day.
And Governor, you mentioned those vans going to college campuses. Do you have any specifics about which campuses will have either the mobile clinics or other types of clinics? Because as we've talked to colleges, they seem to still be a little bit hazy on those details.
Yeah, it's going to take another, week or two, I think, Emily. And obviously, it was a lot easier when we had the J&J vaccine. Now we'll probably be going there often with Moderna and Pfizer, so at least those kids can get their first shot, and then hopefully they get a shot, when they land in Michigan or wherever they happen to be from. And as somebody mentioned before, I'm working very closely with the White House, trying to make sure this is a national initiative, so every college kid around the country gets that vaccination shot before they fly back to Connecticut as well.
So have there been specific college vaccination sites planned at this point? Like, do you know which colleges you'll be going to?
I think that's premature, isn't it, Josh?
Yeah, not yet. More details on that in the coming week or two.
Okay. And Governor, do you have any plans to recommend that UConn mandate vaccines as Rutgers has done? When I was talking with them last week, they said that they were just kind of waiting for guidance from the state on that point.
Let's wait a little bit longer on that, but I understand that universities across the country are doing this. They are in congregate settings. This is an age group which we're finding is susceptible to infection, so it probably makes some sense, but let's wait and see.
And last thing, really quickly, Josh, do you have any idea when those the most updated SVI numbers will be released? Because we normally get those on Thursdays.
Yeah, we do. I'm assuming they'll be out today.
Okay, thank you.
Hearst, Connecticut Media.
Thanks. Governor, you've talked about how you don't think Connecticut is going to see the fourth wave that the CDC is worried about nationally. Do you still think that's the case? And if so, why?
I think that the variants we know about now, in particular B117, the most prevalent one, otherwise known as the New York variant, that's the one that's increasingly prevalent here. We know that the vaccines work against it and are successful. I'd like to think that we're going to have 60% of our people vaccinated in the next week or so. I think we're going to break the back of this thing.
And then speaking of the variants, it looks like the variant originally found in New York is increasing here in Connecticut. Do we know yet what the potential is for that variant to evade the vaccine?
Yeah, we know that the vaccine does not, or the variant does not pierce the vaccine, that the vaccine works against that variant. I'd say the Brazil variant, whatever those numbers are, is probably a little, requires a little bit more work, but that's a very, very tiny piece of our pie here in Connecticut.
And lastly, I just wanted to ask about the future of testing here in Connecticut. You've said sort of continually that, the state is obviously doing much more testing than most other states. Do you expect large-scale, robust testing to continue for a while? And has the testing here mainly been paid for by federal stimulus money?
I can tell you it's largely been paid for by federal stimulus money. Josh and I talk about this. I say when we're 80% vaccinated, how much longer are we going to be testing? But Josh will tell you why.
We're going to be keeping a close eye on that. I think for the foreseeable future, we're going to still need quite a bit of testing. We still have entire age groups that aren't even eligible to be vaccinated yet. And we can assume, as Dr. Gottlieb said last Thursday, that, COVID's not going to go away completely, for the foreseeable future. So we are going to need to maintain some testing infrastructure. How that evolves in the coming weeks and months, we're unsure at this point, but, we're going to err on the side of caution as we have done throughout the crisis.
Thank you.
All right, I'm getting the signal. I'd like to say goodbye to somebody who's been an incredibly important institution in the state of Connecticut, Gary Bamonte. You maybe remember that his grandfather, Frank Pepe, creator of one of the great pizzas on the face of this earth. No offense, New Jersey, but this is one of the great pizzas on the face of this earth. And we lost Gary a few days ago. We just want to say farewell, and there he is with one of his famous heart-shaped pizzas. Breaks our heart. Take care, everybody.